Who encountered Holmes, Dr. Gardner was not impressed. Did Elizabeth Holmes always have big dreams, in your opinion?
Absolutely. Her ambition was over the top. And unfortunately, the person who twice introduced her to me said, she's just brilliant. She's brilliant. And when you're surrounded by Nobel laureates, you take that with a grain of salt, a boulder of salt. She had no knowledge of medicine and a rudimentary knowledge of engineering, and she was 19. And she really didn't want any expertise. She thought she knew it all. Well, you don't at 19, I'm sorry.
Knows the industry inside and out and reveals the strategies deployed by the food giants.
Those three ingredients are so powerful. Salt, they call it the flavor burst because typically it's on the surface of chips, on snacks. It's the first thing that touches the tongue. They love fats as well because those are what they call the mouthfeel, the sensation of biting into a warm toasted cheese sandwich. And then probably the most powerful of the three for many people is sugar, just by basic instinct. And so the industry has engineered what they call the bliss point for the perfect amount of sugar in products, not too little, not
So sometimes I'll profess things. In fact, I profess a lot of things. We are going to talk about some basic functioning of the nervous system, parts, and et cetera, but we're also going to talk about how to apply that knowledge. That said, your healthcare, your well-being is your responsibility. So anytime we talk about tools, please filter it through that responsibility. Talk to a healthcare professional if you're going to explore any new tools or practices, and be smart in your pursuit of these new tools. I also want to emphasize that this podcast and the other things I do on social media are my personal goal of bringing zero cost to consumer information to the general public. It is separate from my role at Stanford University. In that spirit, I really want to thank the sponsors of today's podcast. The first one is Athletic Greens, which is an all-in-one drink. It's a greens drink that has vitamins, minerals, probiotics, prebiotics. I've been using Athletic Greens since
6 years old, and I've given a lot of thought to how that came to pass. When I was about 5 or 6, living at home, right at the end of the Second World War, when all of the remarkable tragedies of the Holocaust sort of came home as my parents got one postcard after another. I remember this, and they're suffering as they got word of relatives that died in the death camps during the war. And I remember being so horrified by that in terms of how evil people could be towards one another. And somewhere around that time, I developed an almost spiritual desire to become a
HIPAA actually protects their medical information. It doesn't.
Oh boy. So this is our first video in a series exploring medical privacy, and it's a doozy. First of all, it's really difficult to get any transparency into the data sharing that goes on in the medical world. But I chatted with 3 people who have managed to get a peek behind the surgical curtain of the behemoth health data industry. There's Twyla Brace, a nurse and president of a non-profit that fights for medical privacy; Rob Frommer, senior attorney with a pro bono law firm that is currently fighting the state of New Jersey for unlawful infant medical data collection; and Keith Smith, co-founder of the Surgery Center of Oklahoma and a practicing anesthesiologist. What I learned from them and from diving deep into this rabbit hole really blew my mind. Essentially, the state of medical privacy is a mess. Throughout this series, we explore electronic health records, their vulnerabilities to hacking, and how they share our sense
had a number of HTU admissions in the past requiring treatment with intravenous salbutamol for exacerbation of asthma, so this puts her at a higher risk of needing similar treatment during this admission. Although her parents tell you she's never been admitted to PICU, she's been close to needing admission a number of times, and she's obviously a child with atopy with a background of eczema and hay fever. Her regular medications include beclomethasone, singular, and salbutamol inhaler are used on a PRN basis, and she doesn't have any known drug allergies. So you assess her using an ABCD approach. When you look at her airway, it's self-maintained. You look at her breathing, and she's tachypneic with a respiratory rate of 60 breaths per minute, which is well above what you'd expect for her age. She also has signs of severe respiratory distress with nasal flaring, tracheal tug.
10 times higher than the typical mortality rate for measles, which is 0.1%. So it makes you ask the question, why is it so high? And I think there's a couple possible answers. One is that people aren't coming to medical care soon enough. They're waiting too long. Two is that it's not 220 cases. It's much more than that. And because it's a somewhat sequestered community that's resistant to sort of having people come in from the outside, that it's actually much more, it's many more cases than that. That's what I worry about.
So let's talk about why this is happening. I think there are many different reasons, but primarily it's because of people not getting vaccinated, right?
That's the reason. I mean, if you look at the that West Texas outbreak, it centers on a Mennonite community that has about 80% vaccination rate, which is not enough to stop the spread of this virus. And if you look at that sort of previous outbreaks, that's the story.
Here is the staff call. They were concerned about you, so they sent me to come and check on you.
Okay, I'm fine. You can go.
Okay, I got to make sure that they want you in there first. Is there a reason you have a general antagonistic disposition towards me?
Yeah.
Why is that?
Because you two goons have come here specifically to try to incite a physical incident with a person who's had a heart attack last week.
What?
And I don't think that's a very good thing, and I don't like that.
Why?
You're being very disruptive, and I wish you folks would step back.
Why do you think that?
Please step back. Because of your body posture, because of the way that you're acting, I take offense to it, and I think that you should stand back.
Okay, I can step back a little bit, but I'm just trying to make
another step or two would be good.
Okay, I'm not going to step any further away, sir.
Okay, that's fine.
Is there anything going on that I can help you with?
Yeah, you can leave.
I can't leave.
The job is literally to manage the $1.7 trillion program that funds Medicare, Medicaid, and the ACA marketplaces. These make up the largest portion of healthcare coverage in America. I thought given the confusion surrounding our insurance industry, it would be great to get an expert in who can teach us the basics and tell us the truth about what makes the system so broken and hopefully how to make it better. I admit the beginning of this conversation can feel a bit overwhelming with all the different partitions behind Medicare, but I urge you to push through as we get into some truly eye-opening discussions about the cuts facing America's healthcare system, surprise billing loopholes, and why that some patients with insurance sometimes pay more for medication than those without. Please welcome Chiquita Brooks LaShore to the Checkup Podcast. Let's talk about the sexiest subject that exists in healthcare, insurance. I think most people just...
Heart attack out of nowhere, and the only thing was he took the vaccine, and there's many cases like that.
Well, first of all, congratulations on the birth of a 7-month-old. The fact that anyone made you feel bad in the healthcare system, I feel like is a failure on us in the healthcare system, so I'm sorry that happened to you. In healthcare, it's very difficult to predict the future because there are so many unknowns and there's so many variables in healthcare. There are things that are a lot that are outside of our control, and we try to do the best with the limited amounts that we can control. So when we see two things happen simultaneously in healthcare, sometimes we think they have caused one another. But unless we see a pattern of that happening over and over again on a large scale, it's more likely that this is just a coincidence of things happening at the same time. For example, I have a friend of mine who's a physician who vaccinates children very regularly. And they were about to give a child the vaccine. And before giving the vaccine,